Free State Premier Sisi Ntombela led the province's Coronavirus Command Council in assessing the Bloemfontein showgrounds. The venue has been earmarked as a possible site for a field hospital to accommodate coronavirus patients there for treatment. We're joined by David Motau, who is the province's Health Department head. Good evening, and thank you so much for your time tonight, Mr. Motau. So has the venue been given the green light in terms of becoming a field hospital?
Good evening, and good evening to your viewers, through listeners at home. Yes, thank you very much for having us. The venue has been given the green light to proceed as a field hospital facility in the Free State, and we are hoping to ramp up our capacity by at least 1,000 beds, oxygenated beds in that facility.
The number of positive COVID-19 cases in the province still remains relatively low. So at what pace are you going to be working to ensure that it's up and ready?
Look, we derived our wisdom from the modelings that have been out there, that have been shared with the South Africans in terms of what needs to happen. As you correctly put it, we're currently sitting at 2,803 cases, and we have about 565 recoveries and only 19 deaths. Now, what we then agreed on initially, we developed about 4 strategies, if you like. The first one was to make sure that each healthcare facility is able to identify patients or people that are infected with coronavirus by screening and testing, but also to make sure that we are able to quarantine or isolate those people. That was the first strategy. The second strategy was to look at the facilities themselves, to say we need to see how many of these facilities can be able to admit those patients. And we came up with a number of beds that at the time we were ready with, and it was far more than what the modeling was saying at the time. We then looked at that was now intra-facility, so we then looked at intra-hospital, we then looked at the intra-facility, which then means we have to look at the parking areas around our facilities. The whole idea was to mainly strengthen the healthcare system in the province, so that post-coronavirus we remain with a stronger healthcare system. So the fourth one was then to look at this field facility, which you've just alluded to. And the fourth one is to make sure that we then also develop other areas within the premises of the Bloemfontein showground. That is our phase 2.
Are there any areas of concern when you look at how the virus is progressing or developing in your province?
Yes, we do have areas of concern. Firstly is the number of cases that are increasing, but secondly is the number of healthcare workers that continue to get infected because these are our frontliners, and without them we will not be able to run a proper healthcare system, let alone the challenges that we would have with the coronavirus. But the third one is the number of hotspots that are beginning to emerge as offshoots, within the province. We're currently dealing with issues around the schools. We're dealing with issues around the mining areas in the Joliputsa and Kharib. But we're also dealing with the community infections that are going on within our communities as we downgrade in terms of the lockdown levels. So that is a challenge for us, and that is what is worrying us. But the one major thing that I think we need to continuously harp on and emphasize is the fact that our healthcare professionals need to make sure that they take responsibility in terms of how they not only deal with treating of patients, but how they conduct themselves. We found that most of our cases would have come from instances where your healthcare professionals would be sitting in one room having tea, chatting to each other without wearing their masks, and the next day you then wake up to a situation where most of your healthcare workers have been infected. So without them, we will definitely not be able to run a healthcare system. So we're trying to make sure that we really deal with that aspect, because if we fail, then that will be the end of, the story in the Free State.
All right, Dr. David Motau, let's leave it there for tonight.